Question 1. Governance review demonstrates that a certified functional medicine practitioner, CFMP, has consistently provided patients with detailed written reports and verbal explanations regarding complex treatment protocols. However, patient adherence rates have been lower than expected, and a significant number of patients have reported confusion about their care plans. Which of the following approaches best addresses this situation in compliance with ethical and professional standards for patient education? Option A. Reduce the complexity of all written materials and verbal explanations to the absolute minimum, omitting any potentially confusing details. Option B. Continue providing detailed written reports and verbal explanations, assuming patients will seek clarification if they have questions. Option C. Implement a standardized patient education program that utilizes plain language, visual aids, and a teach-back method to confirm patient comprehension of all treatment plans and recommendations. Option D. Rely on patient self-reporting of understanding during follow-up appointments without employing specific verification techniques. Correct answer is C. Implement a standardized patient education program that utilizes plain language, visual aids, and a teach-back method to confirm patient comprehension of all treatment plans and recommendations. Explanation. Scenario analysis. This scenario presents a common challenge in functional medicine practice, ensuring patients understand complex health information and treatment plans. The practitioner must balance providing comprehensive care with the patient's capacity to comprehend and act upon that information. The professional challenge lies in tailoring communication to individual health literacy levels, which can vary significantly, to ensure informed consent and adherence to recommendations. Failure to do so can lead to suboptimal outcomes and potential ethical breaches related to patient autonomy and beneficence. Correct approach analysis. The correct approach involves a proactive and individualized strategy to assess and address health literacy. This aligns with the ethical imperative to provide patient-centered care and the regulatory expectation that practitioners ensure patients can make informed decisions. Specifically, it reflects best practices in patient education by utilizing a variety of communication methods, including plain language, visual aids, and teach-back techniques, to confirm understanding. This approach respects patient autonomy by empowering them with comprehensible information, thereby facilitating their active participation in their health journey. It also upholds the principle of beneficence by increasing the likelihood of successful treatment adherence and improved health outcomes. Incorrect approaches analysis. One incorrect approach involves assuming all patients possess a high level of health literacy, and therefore providing information solely through standard written materials and verbal explanations without verification. This fails to acknowledge the diverse literacy levels within the patient population and can lead to misunderstanding, non-adherence, and a violation of the patient's right to informed consent. It neglects the ethical duty of beneficence by not ensuring the patient can effectively utilize the provided information for their well-being. Another incorrect approach is to oversimplify information to the point where crucial details are omitted, thereby providing an incomplete picture of the health condition and treatment options. While aiming for clarity, this can inadvertently mislead the patient or fail to adequately prepare them for the complexities of their health management. This approach undermines the principle of veracity and can compromise the patient's ability to make truly informed choices, potentially leading to dissatisfaction or adverse events. A third incorrect approach is to rely solely on the patient's self-assessment of understanding without employing objective verification methods. Patients may overestimate their comprehension due to politeness, embarrassment, or a lack of awareness of their own knowledge gaps. This reliance on subjective reporting, without employing techniques like teach-back, can create a false sense of understanding, leading to critical misinterpretations of health advice and potentially harmful consequences. This approach fails to meet the standard of care for effective patient education and can be seen as a breach of the practitioner's duty of care. Professional reasoning. Professionals should adopt a patient-centered communication framework that prioritizes clarity, comprehension, and verification. This involves a continuous process of assessing patient understanding, adapting communication strategies as needed, and employing validated techniques to confirm comprehension. When faced with a patient who may have lower health literacy, practitioners should actively seek to simplify language, use visual aids, encourage questions, and utilize teach-back methods. The decision-making process should always begin with an assumption that effective communication is a shared responsibility, requiring both the practitioner to convey information clearly and the patient to demonstrate understanding. This proactive and iterative approach ensures that all patients, regardless of their background, are empowered to participate meaningfully in their healthcare decisions and management. Question 2. Governance review demonstrates that a certified functional medicine practitioner, CFMP, is evaluating a new patient presenting with chronic fatigue, digestive distress, and intermittent joint pain. The practitioner has completed the initial patient interview and physical examination. Which of the following represents the most appropriate next step in the clinical assessment and diagnostic process, adhering to best practices and the CFMP scope of practice? Option A. Order a comprehensive panel of advanced functional laboratory tests to investigate all potential underlying imbalances simultaneously. Option B. Develop a personalized treatment plan focused on symptom management for fatigue, digestive distress, and joint pain without further diagnostic investigation. Option C. Recommend a series of unvalidated diagnostic questionnaires and biofeedback sessions to identify the patient's primary health concerns. Option D. Formulate a prioritized list of differential diagnoses based on the initial assessment and select targeted diagnostic investigations to explore these possibilities. The correct answer is A. Order a comprehensive panel of advanced functional laboratory tests to investigate all potential underlying imbalances simultaneously. Explanation: scenario analysis. This scenario presents a common challenge in functional medicine practice, where a patient exhibits a complex interplay of symptoms suggestive of multiple underlying issues. The practitioner must navigate the diagnostic process efficiently and ethically, ensuring that the assessment is comprehensive without being overly burdensome or leading to premature conclusions. The challenge lies in synthesizing diverse information, prioritizing investigations, and establishing a clear diagnostic pathway that aligns with best practices and regulatory expectations for patient care. Correct approach analysis. The correct approach emphasizes a systematic, evidence-informed diagnostic process. It begins with a thorough history and physical examination, which are foundational to any clinical assessment. This is followed by the judicious selection of diagnostic tests based on the initial findings and the patient-specific presentation. The focus on identifying root causes, rather than just symptom management, is a hallmark of functional medicine and aligns with the CFMP scope of practice. This approach ensures that investigations are targeted, cost-effective, and contribute meaningfully to a differential diagnosis, ultimately leading to a personalized treatment plan. This aligns with ethical obligations to provide competent and evidence-based care, avoiding unnecessary interventions and ensuring patient safety. Incorrect approaches analysis. One incorrect approach involves immediately ordering a broad panel of advanced, often expensive, laboratory tests without a clear hypothesis derived from the initial patient interview and physical examination. This is professionally unacceptable as it represents a shotgun approach to diagnosis, which is inefficient, potentially misleading, and may not adhere to principles of medical necessity. Ethically, it can lead to unnecessary patient financial burden and anxiety. Regulatory frameworks often require that diagnostic testing be justified by clinical findings. Another incorrect approach is to focus solely on symptom relief without investigating the underlying physiological imbalances or contributing factors. This superficial approach fails to address the root causes of the patient's condition, which is contrary to the principles of functional medicine and the CFMP role. Ethically, can lead to a failure to diagnose serious underlying conditions and a perpetuation of chronic illness. This approach may also fall short of regulatory expectations for thorough diagnostic workups. A third incorrect approach is to rely heavily on anecdotal evidence or unvalidated diagnostic methods without integrating them into a scientifically sound diagnostic framework. While patient experience is valuable, diagnostic conclusions must be grounded in established scientific principles and validated testing. Over-reliance on unvalidated methods can lead to misdiagnosis, inappropriate treatment, and potential harm to the patient, which is a clear ethical and potential regulatory violation. Professional reasoning. Professionals should approach clinical assessment and diagnosis by first establishing a strong rapport with the patient and conducting a comprehensive history and physical. This initial phase is crucial for formulating differential diagnoses and guiding subsequent investigations. Diagnostic testing should be selected strategically, prioritizing those that will most effectively clarify the differential diagnoses and identify root causes. Continuous reevaluation of findings and patient response is essential, allowing for adjustments to the diagnostic and treatment plan as needed. This iterative process ensures that care remains patient-centered, evidence-based, and ethically sound. Question 3. Regulatory review indicates that a certified functional medicine practitioner, CFMP, is developing a comprehensive lifestyle intervention plan for a client experiencing chronic fatigue and elevated stress levels. The plan must address exercise, sleep, and stress management. Which of the following approaches best aligns with the CFMP scope of practice and ethical guidelines for implementing lifestyle medicine interventions? Option A. Develop a personalized, gradual exercise progression plan. Provide education on sleep hygiene tailored to the client's reported sleep patterns, and introduce foundational stress reduction techniques like mindful breathing and journaling, while establishing clear referral pathways for any identified underlying medical issues. Option B. Prescribe a high-intensity interval training (HIIT) program immediately to boost energy levels. Recommend a strict 8-hour sleep schedule regardless of the client's current sleep quality, and suggest the client explore advanced meditation apps for stress relief. Option C. Recommend specific supplements known to improve energy and sleep, and suggest the client consult a therapist for stress management, without directly addressing exercise or sleep hygiene within the CFMP Direct Intervention Plan. Option D. Provide a generic handout on the benefits of exercise, sleep, and stress management, and advise the client to research and implement strategies independently based on their own findings. The correct answer is A. Develop a personalized, gradual exercise progression plan. Provide education on sleep hygiene tailored to the client's reported sleep patterns, and introduce foundational stress reduction techniques like mindful breathing and journaling, while establishing clear referral pathways for any identified underlying medical issues. Explanation. Scenario analysis. This scenario presents a common challenge in functional medicine practice, balancing evidence-based lifestyle interventions with individual client adherence and the practitioner's scope of practice. The practitioner must navigate the complexities of recommending exercise, sleep, and stress management strategies while ensuring these recommendations are safe, effective, and align with the client's unique circumstances and the regulatory framework governing their practice. The challenge lies in moving beyond generic advice to personalized, actionable plans that respect client autonomy and the limits of professional expertise. Correct approach analysis. The correct approach emphasizes a collaborative, client-centered strategy that integrates personalized lifestyle modifications within the established scope of practice for a certified functional medicine practitioner, CFMP. This involves a thorough assessment of the client's current lifestyle, barriers to change, and individual needs. The practitioner then co-creates a plan with the client, focusing on gradual, sustainable changes in exercise, sleep hygiene, and stress management techniques. This approach is best professional practice because it respects client autonomy, promotes adherence, and aligns with the ethical principles of beneficence and non-maleficence. It also adheres to the regulatory framework by ensuring recommendations are within the CFMP competency and do not constitute medical diagnosis or treatment beyond their scope. The focus on education and empowerment ensures the client can independently manage their lifestyle factors long-term, a core tenet of functional medicine. Incorrect approaches analysis. One incorrect approach involves prescribing a rigid, one-size-fits-all exercise regimen without considering the client's current fitness level, medical history, or preferences. This fails to acknowledge individual variability and can lead to injury, demotivation, and non-adherence, potentially violating the principle of non-maleficence. Ethically, it demonstrates a lack of personalized care. Another incorrect approach is to provide generic sleep hygiene tips without assessing the client's specific sleep disturbances or potential underlying medical conditions that might require referral. This approach risks overlooking critical factors contributing to poor sleep and may delay appropriate medical intervention, potentially falling outside the CFMP scope of practice if it veers into diagnosing or treating sleep disorders. A third incorrect approach is to recommend advanced stress management techniques, such as biofeedback or specific therapeutic interventions, without proper training or certification in those modalities. This could be construed as practicing outside the CFMP-defined scope of practice, potentially violating regulatory guidelines and posing a risk to the client's well-being. It also fails to address the foundational lifestyle elements that are within the CFMP expertise. Professional reasoning. Professionals should adopt a decision-making process that begins with a comprehensive client assessment, including their current lifestyle habits, perceived barriers, and personal goals. This is followed by an exploration of evidence-based lifestyle interventions within the CFMP scope of practice, prioritizing those that are most relevant and achievable for the individual. Collaborative goal setting and action planning are crucial, ensuring the client is an active participant. Regular follow-up and adjustments to the plan based on client feedback and progress are essential. When lifestyle interventions are insufficient or suggest underlying medical conditions, the professional must recognize the limits of their scope and facilitate appropriate referral to other healthcare providers. This systematic, client-centered, and scope-aware approach ensures ethical and effective practice. Question 4. Quality control measures reveal that a significant portion of patient charts for individuals presenting with complex chronic conditions lack detailed documentation of the initial assessment of lifestyle factors, environmental exposures, and psychosocial stressors as potential contributors to disease etiology. This oversight is impacting the development of individualized, root-cause-oriented treatment plans. Which of the following approaches best addresses this quality control finding within the context of functional medicine's chronic disease models? Option A. Implement a standardized intake questionnaire that systematically captures detailed information on diet, sleep, stress, relationships, and environmental exposures, and mandate its thorough review and integration into the initial patient assessment and subsequent treatment planning. Option B. Rely on patient self-reporting during brief, symptom-focused consultations to identify lifestyle and stress factors, without a structured approach to data collection or analysis. Option C. Focus solely on prescribing evidence-based pharmaceutical interventions that have demonstrated efficacy in managing the primary symptoms of the chronic conditions, as this is the most efficient use of practitioner time. Option D. Increase the frequency of follow-up appointments for patients with chronic conditions to allow for more informal discussions about lifestyle and stress, assuming this will organically uncover contributing factors. The correct answer is A. Implement a standardized intake questionnaire that systematically captures detailed information on diet, sleep, stress, relationships, and environmental exposures, and mandate its thorough review and integration into the initial patient assessment and subsequent treatment planning. Explanation. This scenario presents a professional challenge because it requires the Certified Functional Medicine Practitioner, CFMP, to navigate the complexities of chronic disease management within the established regulatory framework for their practice. The core of the challenge lies in balancing the holistic, individualized approach of functional medicine with the need for evidence-based, compliant interventions. Careful judgment is required to ensure that patient care aligns with both the principles of functional medicine and the governing regulations, which may emphasize specific diagnostic pathways or treatment modalities. The correct approach represents best professional practice because it prioritizes a comprehensive, root-cause investigation that is foundational to functional medicine's chronic disease models. This involves a thorough assessment of the patient's unique biological, psychological, and social factors, leading to a personalized treatment plan. This approach is ethically sound as it respects patient autonomy and aims for optimal health outcomes by addressing underlying imbalances rather than just symptom management. It aligns with the spirit of functional medicine, which seeks to identify and address the fundamental causes of disease. An incorrect approach that focuses solely on symptom suppression without investigating underlying causes fails to adhere to the core principles of functional medicine's chronic disease models. This can lead to suboptimal patient outcomes and may be considered ethically questionable if it neglects a more comprehensive diagnostic and therapeutic strategy. Another incorrect approach that relies exclusively on generalized protocols without individualization neglects the personalized nature of functional medicine and may not adequately address the unique biological terrain of each patient, potentially leading to ineffective treatment and a failure to achieve long-term health improvements. A third incorrect approach that disregards established diagnostic criteria or evidence-based guidelines, even within a functional medicine context, risks patient safety and may violate regulatory expectations for competent practice. Professionals should employ a decision-making framework that begins with a thorough understanding of the patient's presentation and history. This should be followed by an assessment of potential underlying etiologies through a functional medicine lens, integrating relevant diagnostic information. Crucially, this assessment must be conducted within the boundaries of the applicable regulatory framework, ensuring that all diagnostic and therapeutic interventions are compliant and ethically sound. The practitioner must then develop a personalized, evidence-informed treatment plan that addresses the identified root causes, while continuously monitoring patient progress and adjusting the plan as needed. Question 5. The assessment process reveals complex interconnected patterns within a patient's system's biology report, suggesting potential dysregulation in multiple metabolic pathways and cellular communication networks. The practitioner recognizes that these findings, while scientifically intriguing, are not directly aligned with common, well-established functional medicine protocols for the patient's primary complaint. Practitioner must decide how to best incorporate this information into the patient's care plan. Which of the following approaches best reflects professional and ethical practice within the CFMP framework? Option A. Immediately recommend a comprehensive suite of advanced, experimental therapies and specialized supplements targeting all identified complex pathways, assuming that addressing these intricate biological interactions will yield significant improvements, regardless of direct clinical correlation or established efficacy, for the patient's specific symptoms. Option B. Advise the patient that the system's biology report is too complex and not directly applicable to standard functional medicine interventions, and proceed with a generalized treatment protocol based solely on the patient's primary complaint, disregarding the detailed biological data. Option C. Carefully integrate the system's biology findings with the patient's clinical presentation and history, seeking evidence-based connections to functional medicine principles to inform a highly personalized, yet cautious, intervention strategy and clearly communicate the rationale and potential benefits/limitations to the patient. Option D. Present the raw, uninterpreted systems biology data to the patient in its entirety, expecting them to understand the intricate details and make their own informed decisions about which complex biological dysregulations to address. The correct answer is C. Carefully integrate the system's biology findings with the patient's clinical presentation and history, seeking evidence-based connections to functional medicine principles to inform a highly personalized, yet cautious, intervention strategy and clearly communicate the rationale and potential benefits/limitations to the patient. Explanation. Scenario analysis. This scenario presents a professional challenge because it involves a practitioner's interpretation of complex systems biology data in the context of a patient's functional medicine assessment. The challenge lies in balancing the desire to provide comprehensive, personalized care with the ethical obligation to ensure that recommendations are evidence-based and do not overstep the practitioner's scope of practice or lead to unnecessary patient anxiety or financial burden. The practitioner must navigate the nuances of interpreting multifactorial biological interactions and translating them into actionable, safe, and appropriate interventions within the Certified Functional Medicine Practitioner (CFMP) framework. Correct approach analysis. The correct approach emphasizes a thorough, evidence-informed, and patient-centered interpretation of the system's biology data, prioritizes integrating these findings with the patient's clinical presentation, history, and established functional medicine principles. This approach aligns with the CFMP commitment to holistic care, where interventions are tailored to the individual's unique biological landscape. It also reflects the ethical imperative to provide clear, understandable explanations to the patient, manage expectations, and ensure that any proposed interventions are safe, effective, and aligned with the patient's goals and resources. This method upholds the professional standard of care by grounding recommendations in a comprehensive understanding of the patient's biological system and its interconnectedness, while respecting the patient's autonomy and well-being. Incorrect approaches analysis. One incorrect approach involves immediately recommending a broad array of expensive, cutting-edge supplements and therapies based solely on novel or complex patterns identified in the system's biology report, without sufficient clinical correlation or established evidence for efficacy in the patient's specific context. This fails to adhere to the principle of evidence-based practice, potentially leading to patient harm through ineffective or unnecessary treatments, and could be considered a breach of professional responsibility by not adequately vetting interventions. It also risks exploiting patient vulnerability by promoting unproven or overly aggressive protocols. Another incorrect approach is to dismiss the system's biology data entirely, stating it is too complex or not relevant to standard functional medicine practice, and proceeding with a generic protocol. This neglects the potential for valuable insights that systems biology can offer in understanding root causes and individualizing care. It represents a failure to embrace advancements in understanding biological complexity and a missed opportunity to provide truly personalized functional medicine, potentially leading to suboptimal patient outcomes. A third incorrect approach is to present the complex system's biology data to the patient without clear explanation or context, leading to confusion, anxiety, and a feeling of being overwhelmed. This violates the ethical principle of informed consent and clear communication. Practitioners have a duty to translate complex information into understandable terms, empowering patients to make informed decisions about their health. Failing to do so erodes trust and can lead to patient disengagement. Professional reasoning. Professionals should adopt a systematic approach when faced with complex data. This involves 1. Thoroughly understanding the patient's complete health picture, including history, symptoms, and lifestyle. 2. Critically evaluating the system's biology data, cross-referencing findings with established scientific literature and functional medicine principles. 3. Identifying actionable insights that directly relate to the patient's clinical presentation and can be addressed with safe and evidence-supported interventions. 4. Developing a personalized plan that integrates these insights with the patient's goals and preferences, ensuring clear communication and shared decision-making. 5. Continuously monitoring patient progress and adjusting the plan as needed, always prioritizing patient safety and well-being. Question 6. Implementation of a comprehensive dietary plan incorporating functional foods and nutraceuticals for a client experiencing chronic fatigue and digestive distress requires the Certified Functional Medicine Practitioner, CFMP, to consider various approaches to recommending these interventions. Given the client's self-reported symptoms and a desire to explore natural options, which of the following represents the most appropriate and ethically sound strategy for the CFMP? Option A. Focus on marketing the latest popular functional foods and nutraceuticals available, highlighting their trendy appeal and potential for broad health benefits without delving into specific scientific evidence or the client's medical history. Option B. Advise the client that a particular functional food, when consumed daily, will definitively cure their chronic fatigue and eliminate all digestive discomfort within a month. Option C. Educate the client on the general physiological benefits of specific functional foods, e.g., fermented foods for gut health, berries for antioxidant support, and evidence-based nutraceuticals, e.g., probiotics, omega-3 fatty acids, known to support energy metabolism and digestive function, emphasizing that these are complementary to, not replacements for, conventional medical care, and encouraging the client to discuss any proposed changes with their physician. Option D. Recommend a specific branded nutraceutical product that has shown promising results in preliminary studies for fatigue, advising the client that this product is likely to resolve their digestive issues as well. The correct answer is C. Educate the client on the general physiological benefits of specific functional foods, e.g., fermented foods for gut health, berries for antioxidant support, and evidence-based nutraceuticals, e.g., probiotics, omega-3 fatty acids, known to support energy metabolism and digestive function, emphasizing that these are complementary to, not replacements for, conventional medical care, and encouraging the client to discuss any proposed changes with their physician. Explanation. This scenario presents a professional challenge due to the nuanced regulatory landscape surrounding functional foods and nutraceuticals within the Certified Functional Medicine Practitioner, CFMP, framework, which is implicitly tied to U.S. federal regulations and ethical guidelines for health practitioners. The practitioner must navigate the distinction between general health claims and specific disease claims, ensuring that any recommendations are supported by robust scientific evidence and do not constitute unsubstantiated therapeutic claims. The core of the challenge lies in providing evidence-based guidance that empowers the client without crossing the line into medical advice or product endorsement that could be misconstrued as a cure or treatment for a diagnosed condition. The correct approach represents best professional practice because it prioritizes client education and empowerment through evidence-based information, aligning with the CFMP role as a health educator and guide. It focuses on the general health benefits of functional foods and nutraceuticals, emphasizing their role in supporting overall well-being and physiological function, rather than making specific therapeutic claims. This approach respects the client's autonomy and encourages informed decision-making, while remaining within the ethical boundaries of practice and avoiding any potential misrepresentation of the product's capabilities. It also implicitly adheres to FDA guidelines regarding health claims and structure/function claims for dietary supplements and foods, an incorrect approach that suggests recommending specific branded nutraceuticals for a diagnosed condition fails on multiple regulatory and ethical fronts. It risks making unsubstantiated therapeutic claims, which is a violation of FDA regulations for dietary supplements and foods. Ethically, it could be perceived as endorsing specific products without sufficient evidence of efficacy for the stated condition, potentially leading to a delay in appropriate medical care and exploitation of the client's health concerns. Furthermore, recommending specific brands can create a conflict of interest if the practitioner has any financial ties to those products, which is an ethical breach. Another incorrect approach that involves making definitive statements about a nutraceutical curing a client's diagnosed condition is a severe regulatory and ethical failure. This constitutes an unsubstantiated therapeutic claim, which is illegal and misleading under FDA regulations. It also represents practicing medicine without a license if the practitioner is not a licensed physician. Ethically, it is highly irresponsible and potentially harmful, as it can lead to a false sense of security and prevent the client from seeking evidence-based medical treatment. Finally, an incorrect approach that focuses solely on the marketing of functional foods and nutraceuticals without regard for scientific evidence or client-specific needs is also professionally unacceptable. This prioritizes commercial interests over client well-being and can lead to the promotion of ineffective or even harmful products. It disregards the ethical obligation to provide accurate, evidence-based information and can erode trust in the practitioner and the field of functional medicine. The professional decision-making process for similar situations should involve a thorough understanding of the scientific literature supporting the use of functional foods and nutraceuticals, a clear grasp of the regulatory distinctions between general health claims and disease claims, particularly under FDA guidelines, and a commitment to ethical practice that prioritizes client safety and autonomy. Practitioners should always frame recommendations within the context of supporting overall health and well-being, encouraging clients to consult with their primary healthcare providers for diagnosis and treatment of specific medical conditions. Question 7. Operational review demonstrates that a certified functional medicine practitioner, CFMP, is treating a patient with multiple chronic conditions. The practitioner has identified several key biomarkers indicating inflammation and metabolic dysfunction. The patient expresses significant fatigue, pain, and distress, and states their primary goal is to regain energy to participate in family activities. The practitioner is considering a treatment plan that aggressively targets the identified biomarkers with pharmaceutical interventions and supplements, with the intention of normalizing these markers as quickly as possible, even if it means significant dietary restrictions and a demanding supplement regimen that may initially exacerbate fatigue. Which of the following approaches best aligns with the principles of patient-centered care within the CFMP framework? Option A. Develop a collaborative treatment plan that prioritizes gradual biomarker improvement alongside strategies to manage the patient's fatigue and pain, ensuring the plan is sustainable and aligns with their stated goals of increased energy for family activities. Option B. Prioritize symptom relief by prescribing medications to mask the fatigue and pain, while deferring a deeper investigation into the root causes until the patient's immediate discomfort is managed. Option C. Focus exclusively on the patient's stated goal of increased energy and postpone addressing the identified inflammatory and metabolic biomarkers until the patient reports feeling significantly better. Option D. Implement a rigorous treatment protocol focused on rapidly normalizing all identified biomarkers using the most potent pharmaceutical and supplement interventions available, as this is the most direct path to addressing the underlying disease processes. Correct answer is A. Develop a collaborative treatment plan that prioritizes gradual biomarker improvement alongside strategies to manage the patient's fatigue and pain, ensuring the plan is sustainable and aligns with their stated goals of increased energy for family activities. Explanation. This scenario presents a common challenge in healthcare, where the practitioner's approach can inadvertently shift from a holistic, patient-centered model to a more disease-focused one, particularly when faced with complex or chronic conditions. The professional challenge lies in maintaining the core principles of functional medicine, which emphasize understanding the individual's unique biological, psychological, and social context, while also addressing specific diagnostic findings and treatment protocols. The tension arises from the potential to prioritize symptom management and disease eradication over the patient's overall well-being. Goals and lifestyle. The correct approach represents best professional practice by upholding the foundational tenets of patient-centered care as mandated by ethical guidelines and the spirit of functional medicine. This involves actively listening to the patient's narrative, understanding their values and priorities, and collaboratively developing a treatment plan that addresses the root causes of their health issues while respecting their individual circumstances and preferences. This aligns with the ethical imperative to provide individualized care and promote patient autonomy, ensuring that treatment is not merely about eradicating a disease, but about restoring optimal health and function in a way that is meaningful to the patient. An incorrect approach that prioritizes disease markers over the patient's lived experience and goals would represent a failure to adhere to patient-centered care principles. This could lead to a treatment plan that is technically sound from a disease management perspective, but fails to address the patient's overall quality of life, adherence challenges, or underlying contributing factors that are not directly measured by standard disease markers. Ethically, this approach risks objectifying the patient, reducing them to a set of symptoms or lab values, and undermining their agency in their own healthcare journey. It may also inadvertently lead to overlooking crucial lifestyle or environmental factors that are central to functional medicine's approach to root cause resolution. Another incorrect approach that focuses solely on rapid symptom suppression without exploring underlying causes would also be professionally unacceptable. While symptom relief is important, a functional medicine practitioner's ethical and professional obligation is to investigate and address the root causes of illness. Neglecting this aspect, even with the patient's initial agreement, can lead to a superficial resolution that does not promote long-term health and may mask more significant underlying issues. This deviates from the core philosophy of functional medicine and can lead to a cycle of symptom management without true healing. The professional decision-making process for similar situations should involve a continuous dialogue with the patient. Practitioners should regularly assess whether the treatment plan remains aligned with the patient's goals and values, and whether it is addressing the multifaceted nature of their health. This requires a commitment to ongoing assessment, flexibility in adapting treatment strategies, and a willingness to reevaluate priorities in partnership with the patient. The practitioner must act as a guide and educator, empowering the patient to be an active participant in their healing process, rather than simply a recipient of interventions. Question 8. The risk matrix shows a moderate to high risk associated with the depth and breadth of patient history taken by a certified functional medicine practitioner, CFMP. Considering the regulatory framework and ethical guidelines applicable to CFMP, which approach to comprehensive patient history taking best mitigates these risks and upholds professional standards. Option A. Primarily focusing on a standardized symptom checklist to ensure all patients are assessed for common conditions, with minimal deviation for individual circumstances. Option B. Systematically gathering detailed information across biomedical, lifestyle, environmental, and psychosocial domains, actively probing for connections and underlying causes, and documenting the process thoroughly. Option C. Relying on the patient's self-reported symptoms without further questioning, assuming their understanding of their health is complete and accurate. Option D. Prioritizing the collection of readily available medical records and focusing on the chief complaint to expedite the consultation and treatment planning. The correct answer is B. Systematically gathering detailed information across biomedical, lifestyle, environmental, and psychosocial domains, actively probing for connections and underlying causes, and documenting the process thoroughly. Explanation. The risk matrix shows a moderate to high risk associated with incomplete patient history, taking in the context of functional medicine practice, particularly concerning potential adverse outcomes and regulatory noncompliance. This scenario is professionally challenging because it requires practitioners to balance thoroughness with efficiency, ensuring all relevant information is gathered without overwhelming the patient or compromising the integrity of the consultation. The CFMP designation implies adherence to specific professional standards and ethical guidelines, which are paramount in patient care. The correct approach represents best professional practice because it prioritizes a comprehensive and systematic collection of patient history, encompassing lifestyle, environmental, and psychosocial factors alongside biomedical data. This aligns with the core principles of functional medicine, which seeks to identify and address the root causes of illness. Regulatory frameworks for healthcare practitioners, including those implied by CFMP certification, mandate accurate record-keeping and informed consent, both of which are underpinned by a complete patient history. Ethical considerations also demand that practitioners gather sufficient information to provide safe and effective care, avoiding assumptions or omissions that could lead to harm. An incorrect approach that relies solely on a checklist without probing for nuanced details fails to capture the interconnectedness of factors influencing health, a cornerstone of functional medicine. This could lead to misdiagnosis or ineffective treatment plans, potentially violating professional standards of care and leading to patient dissatisfaction or harm. Another incorrect approach that prioritizes speed over depth risks overlooking critical information, such as subtle environmental exposures or significant psychosocial stressors, which could be the underlying drivers of a patient's condition. This omission could be construed as negligence and a failure to meet the expected standard of care, potentially exposing the practitioner to regulatory scrutiny. Furthermore, an approach that neglects to document the history-taking process thoroughly or fails to obtain informed consent regarding the scope of information gathering directly contravenes regulations concerning patient records and autonomy. The professional decision-making process for similar situations should involve a structured yet flexible approach to history-taking. Practitioners should be trained to identify red flags in areas requiring deeper exploration, adapting their questioning based on the patient's responses and presentation. This involves active listening, empathetic inquiry, and a commitment to understanding the patient's unique narrative. Regular review of best practices and adherence to established ethical codes are crucial for maintaining a high standard of care and ensuring regulatory compliance. Question 9. Risk assessment procedures indicate that a certified functional medicine practitioner, CFMP, is reviewing a comprehensive panel of functional lab tests for a new patient presenting with fatigue and digestive complaints. The practitioner notes several markers that fall outside standard laboratory reference ranges, as well as some that are within the standard range but appear to be trending in a direction that suggests suboptimal function based on functional medicine literature. The practitioner must decide on the most appropriate next step in interpreting these results. Which of the following approaches best reflects professional best practice for a CFMP? Option A. Immediately initiate a treatment protocol targeting the most significantly abnormal lab values, as these are the primary indicators of the patient's health issues. Option B. Correlate all lab findings, both within and outside standard reference ranges, with the patient's detailed health history, symptom presentation, and lifestyle factors to identify potential patterns and root causes before formulating a personalized plan. Option C. Focus solely on the lab values that fall outside the standard reference ranges, as these are the only objective indicators of dysfunction that require intervention. Option D. Recommend a repeat of all lab tests immediately to confirm the initial findings, without further interpretation or consideration of the patient's symptoms. The correct answer is B. Correlate all lab findings, both within and outside standard reference ranges, with the patient's detailed health history, symptom presentation, and lifestyle factors to identify potential patterns and root causes before formulating a personalized plan. Explanation. Scenario analysis. This scenario is professionally challenging because interpreting functional lab tests requires a nuanced understanding that goes beyond simply looking at reference ranges. Practitioners must integrate multiple data points, consider the individual's unique health history, lifestyle, and symptoms, and understand the dynamic nature of biological systems. The challenge lies in avoiding oversimplification or misinterpretation, which could lead to inappropriate recommendations and potentially harm the patient. The CFMP designation implies a commitment to a holistic and evidence-informed approach, necessitating careful judgment in applying test results to clinical practice. Correct approach analysis. The correct approach represents best professional practice because it aligns with the core principles of functional medicine and ethical practice. It emphasizes a comprehensive, individualized assessment that considers the patient's entire health picture. By correlating lab findings with clinical presentation and history, the practitioner ensures that interventions are targeted and relevant to the individual's specific needs. This approach respects the complexity of human physiology and avoids a reductionist view of health. Ethically, it prioritizes patient well-being by ensuring that recommendations are based on a thorough understanding of the individual rather than isolated data points. This aligns with the expectation that CFMP will provide personalized, evidence-based care. Incorrect approaches analysis. One incorrect approach involves solely relying on standard reference ranges for interpretation. This fails to acknowledge that functional medicine often seeks to identify optimal ranges or patterns that may differ from conventional reference ranges, which are typically designed to identify disease states rather than optimal health. This can lead to overlooking suboptimal function or recommending interventions when they are not truly indicated, potentially causing unnecessary expense or side effects for the patient. It also neglects the individualized nature of functional medicine. Another incorrect approach is to make definitive diagnoses or treatment plans based on a single abnormal lab value without considering the broader clinical context. Functional lab tests are often indicators of physiological processes, not direct diagnoses. Isolating one marker can lead to misdiagnosis and inappropriate treatment, failing to address the root cause of the patient's health concerns. This approach is ethically problematic as it can lead to ineffective or harmful interventions and a failure to provide comprehensive care. A third incorrect approach is to recommend aggressive interventions based on minor deviations from reference ranges without sufficient clinical correlation or patient consent. This can lead to patient anxiety, financial burden, and potential iatrogenic effects from unnecessary treatments. It demonstrates a lack of professional judgment and a failure to adhere to the principle of do no harm. It undermines patient trust in the practitioner-patient relationship. Professional reasoning. Professionals should approach functional lab test interpretation by first understanding the purpose and limitations of each test. They must then integrate these results with a thorough patient history, including symptoms, lifestyle, diet, stress levels, and environmental exposures. A systematic review of all available data, looking for patterns and correlations, is crucial. When considering interventions, the practitioner should prioritize those with strong evidence supporting their efficacy and safety for the specific patient's presentation. Ongoing monitoring and reassessment are essential to evaluate the effectiveness of interventions and adjust the plan as needed. This iterative process ensures that care remains patient-centered and evidence-informed. Question 10. Investigation of integrative diagnostic approaches for a patient presenting with chronic fatigue and cognitive fog. Which of the following methodologies best aligns with the principles and regulatory framework of a certified functional medicine practitioner, CFMP? Option A. A broad panel of pharmaceutical drug efficacy tests to determine if the patient's symptoms are a side effect of unprescribed over-the-counter medications. Option B. An immediate referral for advanced neuroimaging and genetic sequencing to identify rare neurological disorders, without prior exploration of lifestyle or biochemical factors. Option C. A comprehensive assessment including detailed patient history, lifestyle analysis, targeted laboratory testing for nutrient deficiencies, inflammatory markers, and gut microbiome analysis, interpreted within the context of physiological function and interconnectedness. Option D. The exclusive use of energy field testing and aura photography to diagnose the root cause of the patient's symptoms, bypassing conventional or functional laboratory assessments. The correct answer is C. A comprehensive assessment including detailed patient history, lifestyle analysis, targeted laboratory testing for nutrient deficiencies, inflammatory markers, and gut microbiome analysis, interpreted within the context of physiological function and interconnectedness. Explanation. This scenario presents a professional challenge because it requires a certified functional medicine practitioner, CFMP, to navigate the integration of diverse diagnostic modalities while adhering to the specific regulatory framework governing their practice. The core difficulty lies in discerning which diagnostic approaches are permissible and ethically sound within the established guidelines, particularly when considering the potential for misinterpretation or overreach beyond the scope of functional medicine practice, as defined by the CFMP certification standards. The correct approach represents best professional practice because it prioritizes diagnostic methods that are evidence-based, directly relevant to functional medicine principles, and align with the scope of practice defined by the CFMP certification. This involves a thorough understanding of how each diagnostic tool contributes to identifying root causes of dysfunction, rather than merely treating symptoms. Adherence to these principles ensures patient safety, promotes effective care, and maintains professional integrity within the regulatory framework. An incorrect approach, such as relying solely on unvalidated or experimental diagnostic tests without proper scientific backing or regulatory approval, constitutes a significant ethical and potentially regulatory failure. This could lead to misdiagnosis, inappropriate treatment plans, and financial burden on the patient without clear benefit. Furthermore, recommending diagnostic tests that fall outside the scope of practice for a CFMP, as defined by the certification body, could be considered a breach of professional boundaries and potentially violate guidelines related to scope of practice and professional conduct. A professional decision-making process for similar situations should involve a systematic evaluation of any proposed diagnostic approach against the following criteria. 1. Is the diagnostic method evidence-based and scientifically validated? 2. Does it directly contribute to understanding the underlying physiological imbalances relevant to functional medicine? 3. Is it within the defined scope of practice for a CFMP? 4. Are there clear ethical considerations regarding patient consent, data privacy, and potential for harm? 5. Does it align with the regulatory framework and guidelines of the CFMP certification? Question 11. What factors determine the accurate historical context and evolution of functional medicine as a distinct healthcare discipline? Option A. The primary focus on the commercialization of health products and the rise of the wellness industry. Option B. The prevalence of anecdotal success stories shared within online health communities. Option C. The complete rejection of all conventional medical practices and a sole reliance on alternative therapies. Option D. The integration of emerging scientific research, the influence of pioneering practitioners, and the growing patient demand for personalized, root-cause-oriented care. The correct answer is D. The integration of emerging scientific research, the influence of pioneering practitioners, and the growing patient demand for personalized, root-cause-oriented care. Explanation. This scenario is professionally challenging because understanding the historical context of functional medicine is crucial for practitioners to accurately assess its evolution and differentiate it from other health modalities. This requires a deep understanding of the foundational principles and how they have been shaped by scientific advancements and societal needs, rather than superficial or misinformed interpretations. The correct approach represents best professional practice because it acknowledges the multifaceted influences on functional medicine's development. This includes recognizing the impact of early pioneers, the integration of emerging scientific research e.g., genomics, microbiome research, and the growing patient demand for personalized, root-cause-oriented care. Adhering to this comprehensive view ensures that a practitioner's understanding is grounded in the actual trajectory of the field, enabling them to apply its principles effectively and ethically within their practice. Aligning with the spirit of the CFMP certification, which emphasizes a thorough and evidence-based approach. An incorrect approach that focuses solely on the commercial aspects of health and wellness trends fails to acknowledge the scientific and philosophical underpinnings of functional medicine. This is an ethical failure as it misrepresents the discipline and could lead to practitioners offering services based on fads rather than established principles, potentially misleading patients and undermining the credibility of functional medicine. Another incorrect approach that emphasizes only the rejection of conventional medicine overlooks the fact that functional medicine often seeks to complement, rather than entirely replace, conventional approaches. This is a professional failure as it creates an artificial dichotomy, hindering collaboration and potentially limiting patient care options. It also ignores the historical integration of scientific discoveries that have informed functional medicine. A further incorrect approach that prioritizes anecdotal evidence over scientific literature represents a significant ethical and professional failure. Functional medicine, while patient-centered, is built upon scientific inquiry and evidence-based practices. Relying solely on anecdotes would violate the principles of responsible healthcare, potentially leading to ineffective or harmful interventions, and failing to meet the standards expected of a certified functional medicine practitioner. The professional decision-making process for similar situations should involve critically evaluating the origins and evolution of any health modality. Practitioners should seek out information from reputable sources, including peer-reviewed literature, foundational texts, and established professional organizations. They should be able to articulate the core principles, historical influences, and scientific basis of the approaches they employ, ensuring their practice is both ethical and effective. This involves a continuous learning process and a commitment to evidence-based practice. Question 12. When evaluating a new patient presenting with chronic fatigue and digestive distress, what is the most appropriate method for constructing a functional medicine timeline that comprehensively addresses the patient's health history and potential root causes? Option A. Focus primarily on the patient's current symptoms and recent laboratory results, as these are the most immediate indicators of their health status and require the most urgent attention. Option B. Compile a detailed chronological list of all medical diagnoses and treatments the patient has ever received, regardless of their relevance to current complaints, to ensure no detail is overlooked. Option C. Systematically review the patient's entire health history from birth to the present, identifying key life events, exposures, and health milestones, and contextualize each within the functional medicine framework to understand its potential influence on current physiology. Option D. Create a timeline that definitively links each past illness or event to a specific current symptom, providing a clear cause and effect narrative for the patient's condition. The correct answer is C. Systematically review the patient's entire health history from birth to the present, identifying key life events, exposures, and health milestones, and contextualize each within the functional medicine framework to understand its potential influence on current physiology. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the practitioner to integrate historical health data with current functional medicine principles to create a comprehensive timeline. The challenge lies in accurately interpreting past events, understanding their potential long-term impact on current health, and presenting this information in a way that is both clinically relevant and ethically sound, without making unsubstantiated claims or violating patient privacy. The practitioner must balance the need for thoroughness with the patient's understanding and consent. Correct approach analysis. The correct approach involves a systematic review of the patient's entire health history, from birth to the present, identifying key life events, exposures, and health milestones. This includes significant illnesses, injuries, surgeries, medication, lifestyle changes, environmental exposures, and family history. Each piece of information is then contextualized within the functional medicine framework, considering its potential influence on the patient's current physiological state, genetic predispositions, and environmental interactions. This approach aligns with the core principles of functional medicine, which emphasizes understanding the root causes of illness by examining the interconnectedness of biological systems over time. It respects the patient's narrative and empowers them with a deeper understanding of their health journey, fostering a collaborative approach to care. This is ethically sound as it is patient-centered and evidence-informed, focusing on personalized care. Incorrect approach is analysis. One incorrect approach would be to focus solely on recent symptoms and current lab results, neglecting the historical context. This fails to adhere to the functional medicine paradigm of identifying root causes, which are often rooted in past events or exposures. Ethically, this approach could lead to a superficial understanding of the patient's condition, potentially resulting in ineffective treatment plans and a failure to address underlying issues. It also disrespects the patient's lived experience by minimizing the significance of their past health journey. Another incorrect approach would be to present the timeline as a definitive cause and effect relationship for every past event, making definitive pronouncements about how each past illness directly caused a current symptom without sufficient scientific backing. This is a regulatory and ethical failure, as it can lead to patient anxiety, misdiagnosis, and potentially unnecessary interventions. It also oversteps the bounds of professional practice by making unsubstantiated claims, which can be misleading and harmful. A third incorrect approach would be to include highly sensitive or irrelevant personal information in the timeline that is not directly related to the patient's health or functional medicine assessment, without explicit patient consent. This constitutes a breach of patient confidentiality and privacy, violating ethical guidelines and potentially legal regulations regarding protected health information. The focus must remain on clinically relevant data that informs the functional medicine assessment. Professional reasoning. Professionals should approach timeline creation by first establishing clear objectives for the assessment with the patient. They should then gather information through a combination of patient interviews, medical records, and validated questionnaires, ensuring all data collection is consensual and respects privacy. The analysis should be guided by functional medicine principles, looking for patterns, triggers, and mediators of illness. The resulting timeline should be presented to the patient in a clear, understandable, and non-judgmental manner, facilitating shared decision-making and empowering them in their health journey. Continuous professional development in understanding the long-term impacts of various exposures and conditions is crucial. Question 13. Stakeholder feedback indicates a growing interest among clients in understanding the role of neurotransmitter function in their reported feelings of low mood and anxiety. As a certified functional medicine practitioner, CFMP, how should you approach a client presenting with these concerns, ensuring adherence to regulatory frameworks and ethical practice? Option A. Provide a detailed explanation of neurotransmitter pathways and suggest a generic list of brain-boosting foods and supplements without conducting any specific assessments or considering the client's individual health status or existing medical care. Option B. Immediately recommend a high-dose supplement regimen of neurotransmitter precursors based on the client's self-reported symptoms to rapidly improve their mood and reduce anxiety. Option C. Advise the client to discontinue any current psychiatric medications and focus solely on a strict dietary overhaul and herbal remedies to rebalance their neurotransmitters. Option D. Conduct a comprehensive functional assessment, including relevant lifestyle, nutritional, and biochemical markers, and collaborate with the client's primary care physician or a mental health professional for diagnosis and management of any diagnosed mental health conditions, while providing supportive functional interventions. The correct answer is D. Conduct a comprehensive functional assessment, including relevant lifestyle, nutritional, and biochemical markers, and collaborate with the client's primary care physician or a mental health professional for diagnosis and management of any diagnosed mental health conditions, while providing supportive functional interventions. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified functional medicine practitioner, CFMP, to navigate the complex interplay between neurotransmitter function and mental health, while strictly adhering to the regulatory framework governing their practice. The challenge lies in distinguishing between evidence-based functional medicine interventions and unsubstantiated claims, particularly when dealing with sensitive mental health conditions. The practitioner must ensure that their recommendations are safe, effective, and align with established professional standards and any applicable regulations for practitioners in their jurisdiction, without overstepping the scope of practice or making definitive diagnoses that fall under the purview of licensed medical professionals. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-informed assessment that considers multiple contributing factors to mental well-being. This approach aligns with the CFMP role in supporting optimal physiological function and addressing root causes of imbalance. It emphasizes collaboration with licensed healthcare providers for diagnosis and treatment of mental health disorders, ensuring patient safety and adherence to regulatory boundaries. By focusing on lifestyle, nutrition, and targeted supplementation based on functional assessments, the practitioner operates within their scope, promoting holistic health and well-being without making medical claims or replacing conventional medical care. This approach is ethically sound and professionally responsible, respecting the expertise of other healthcare professionals and prioritizing patient welfare. Incorrect approach is analysis. An approach that focuses solely on prescribing high-dose neurotransmitter precursors without a thorough assessment or consideration of potential interactions or contraindications is a significant regulatory and ethical failure. Acts could be construed as practicing medicine without a license or making unsubstantiated therapeutic claims, violating professional conduct guidelines and potentially endangering the patient. An approach that dismisses the role of conventional medical diagnosis and treatment for mental health conditions in favor of exclusively functional interventions is also a failure. This disregards the established medical model for diagnosing and managing mental health disorders, which is a critical regulatory and ethical boundary. It can lead to delayed or inadequate treatment for serious conditions, posing a risk to patient safety. An approach that relies on anecdotal evidence or unverified protocols for neurotransmitter balancing, without grounding interventions in scientific literature or functional assessment data, is unprofessional. This lacks the rigor expected of a CFMP and can lead to ineffective or even harmful recommendations, violating the principle of providing evidence-informed care. Professional reasoning. Professionals should employ a decision-making framework that begins with understanding the patient's presenting concerns and medical history. This involves active listening and gathering information, followed by a comprehensive functional assessment. Crucially, this assessment should inform the practitioner's scope of practice, identifying areas where they can provide support and areas that require referral to or collaboration with licensed medical professionals, particularly for diagnosis and management of mental health conditions. Interventions should be evidence-based, personalized, and integrated within a collaborative care model, always prioritizing patient safety and regulatory compliance. Question 14. The control framework reveals that a certified functional medicine practitioner, CFMP, is consulting with a patient who expresses significant anxiety about the potential impact of environmental toxins on their chronic fatigue and digestive issues. The patient is seeking specific interventions to detoxify their body. The CFMP has completed training on general principles of detoxification pathways and common environmental exposures, but is not a licensed medical doctor. What is the most appropriate course of action for the CFMP in this situation? Option A. Immediately recommend a specific, multi-step detoxification protocol, including a list of supplements and dietary restrictions to address the patient's suspected toxin overload. Option B. Provide a detailed interpretation of potential environmental toxin exposure based on the patient's symptoms and suggest specific laboratory tests that the patient can order independently for self-diagnosis. Option C. Educate the patient on general principles of detoxification and environmental toxin exposure, and strongly recommend they consult with a qualified medical doctor or specialist for diagnosis and appropriate medical management of their symptoms. Option D. Advise the patient that concerns about environmental toxins are outside the scope of functional medicine practice and dismiss their concerns without further guidance. The correct answer is C. Educate the patient on general principles of detoxification and environmental toxin exposure, and strongly recommend they consult with a qualified medical doctor or specialist for diagnosis and appropriate medical management of their symptoms. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between a practitioner's desire to provide comprehensive care and the limitations imposed by regulatory frameworks and scope of practice. The practitioner must navigate the ethical imperative to address a patient's concerns about environmental toxins and their impact on health, while simultaneously adhering to the specific guidelines and limitations of their certification. Misinterpreting or exceeding these boundaries can lead to regulatory violations, patient harm, and damage to professional credibility. The practitioner's responsibility is to offer evidence-based guidance within their defined expertise, avoiding unsubstantiated claims or interventions that fall outside their purview. Correct approach analysis. The correct approach involves acknowledging the patient's concerns, educating them on general principles of detoxification and environmental toxin exposure, and recommending consultation with a qualified medical doctor or specialist for diagnosis and treatment. This aligns with the ethical duty of care and the principle of practicing within one's scope of expertise. It respects the regulatory framework by not offering medical advice or treatment plans that require a physician's license. Furthermore, it empowers the patient to seek appropriate, licensed medical care for their specific health issues, ensuring they receive the highest standard of medical attention. This approach prioritizes patient safety and adheres to professional standards by deferring to licensed medical professionals for diagnosis and treatment. Incorrect approaches analysis. One incorrect approach involves directly recommending specific supplements or dietary protocols to address the patient's suspected toxin-related symptoms without a medical diagnosis. This constitutes practicing medicine without a license, a clear violation of regulatory frameworks governing healthcare professionals. It also bypasses the essential step of medical evaluation, potentially leading to misdiagnosis, delayed appropriate treatment, and patient harm. Ethically, it breaches the duty to practice within one's scope and to avoid making unsubstantiated claims. Another incorrect approach is to dismiss the patient's concerns about environmental toxins entirely, stating that it is outside the scope of practice, without offering any educational resources or guidance on seeking appropriate medical help. While technically adhering to scope of practice, this approach fails the ethical obligation to provide compassionate and informative care. It can leave the patient feeling unheard and unsupported, potentially discouraging them from seeking necessary medical attention. It lacks the professional responsibility to guide patients toward appropriate resources when their concerns touch upon areas that require medical expertise. A third incorrect approach is to provide a detailed detoxification plan, including specific laboratory testing recommendations and interpretation, without being a licensed physician. This directly infringes upon the exclusive domain of medical practice, which includes diagnosis, treatment, and ordering of diagnostic tests. Such actions are strictly prohibited by medical practice acts and can result in severe legal and regulatory penalties, including fines and loss of certification. It also exposes the patient to significant risk by circumventing the established medical system. Professional reasoning. Professionals should adopt a decision-making process that begins with active listening and empathetic acknowledgement of the patient's concerns. This should be followed by a clear assessment of whether the patient's needs fall within the practitioner's defined scope of practice and certification. If the concerns involve medical diagnosis, treatment, or management of health conditions, the professional must ethically and legally refer the patient to a qualified medical doctor or appropriate specialist. Providing general educational information about health topics is permissible, but it must be clearly distinguished from medical advice or treatment. Maintaining clear boundaries, prioritizing patient safety, and adhering strictly to regulatory guidelines are paramount in all professional interactions. Question 15. Process analysis reveals that a certified functional medicine practitioner, CFMP, is developing their service offerings. Considering the definition and scope of functional medicine as understood within the CFMP regulatory framework, which of the following best describes the practitioner's approach to defining their scope of practice? Option A, focusing exclusively on symptom management and prescribing conventional treatments to alleviate immediate patient discomfort. Option B, limiting practice to only those diagnostic tests that are universally recognized and reimbursed by standard health insurance providers. Option C, prioritizing a holistic, patient-centered methodology that investigates the root causes of illness by considering the interplay of genetic, environmental, and lifestyle factors. Option D, adopting a purely reductionist approach, dissecting health issues into isolated biological components without considering the patient's broader context. The correct answer is C, prioritizing a holistic, patient-centered methodology that investigates the root causes of illness by considering the interplay of genetic, environmental, and lifestyle factors. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a practitioner to navigate the evolving landscape of functional medicine within a defined regulatory framework, specifically the Certified Functional Medicine Practitioner, CFMP, standards. The core challenge lies in accurately defining the scope of practice for functional medicine, distinguishing it from conventional medical practice, and ensuring that all services offered align with the CFMP ethical and regulatory guidelines. Misinterpreting the scope can lead to providing services outside of one's competency or regulatory authorization, potentially harming patients and incurring professional sanction. Careful judgment is required to balance patient-centered care with adherence to established professional boundaries and legal requirements. Correct approach analysis. The correct approach represents best professional practice because it emphasizes a holistic, patient-centered methodology that addresses the root causes of illness by considering the interplay of genetic, environmental, and lifestyle factors. This aligns with the foundational principles of functional medicine and the CFMP mandate to promote comprehensive wellness. by focusing on identifying and addressing underlying imbalances, rather than solely managing symptoms. Practitioners operate within the ethical framework of promoting long-term health and well-being. This approach is also compliant with the CFMP likely emphasis on evidence-based practices and the integration of various therapeutic modalities, provided they are within the practitioner's scope of practice and supported by appropriate training and certification. Incorrect approach is analysis, an approach that solely focuses on symptom management without investigating underlying causes fails to embody the core tenets of functional medicine. This is a regulatory and ethical failure because it deviates from the CFMP expected scope, which is to address the whole person and the root of dysfunction. It risks providing superficial care that does not lead to sustainable health outcomes, potentially violating the ethical duty to provide effective and comprehensive care. An approach that exclusively relies on diagnostic tests without considering the patient's lifestyle and environmental factors is also problematic. This is an ethical failure as it neglects the holistic nature of functional medicine, which is a cornerstone of the CFMP designation. It also represents a potential regulatory failure if it leads to unnecessary or inappropriate testing, deviating from the principle of personalized and targeted interventions. An approach that limits practice to only those interventions explicitly listed in conventional medical guidelines, while ignoring the broader scope of functional medicine, is an ethical failure. It restricts the practitioner's ability to offer the full spectrum of functional medicine services that are within the CFMP purview and potentially beneficial to patients. This approach fails to leverage the unique value proposition of functional medicine as defined by the CFMP framework. Professional reasoning. Professionals should approach defining the scope of functional medicine by first thoroughly understanding the CFMP-specific guidelines and any relevant national or regional regulations governing complementary and integrative health practices. This involves recognizing functional medicine as a distinct paradigm that investigates the complexities of health and disease through a systems-oriented approach. Decision-making should be guided by a commitment to patient-centered care, evidence-informed practice, and ethical principles that prioritize patient safety and well-being. When in doubt about the appropriateness of a particular service or intervention, practitioners should consult their professional body, seek further training, or refer the patient to a more appropriate provider. The focus should always be on providing the highest quality of care within the defined scope of practice, ensuring that all interventions are personalized, evidence-based, and aimed at addressing the root causes of health issues. Question 16. The monitoring system demonstrates that a certified functional medicine practitioner, CFMP, is reviewing patient records and considering recommendations for herbal supplements. The practitioner has identified an herbal product that is marketed as a dietary supplement and is considering recommending it to a patient for a specific health concern. Which of the following approaches best aligns with regulatory compliance and professional best practices for CFMP in the United States when recommending herbal products? Option A. Recommending the herbal product based on its traditional use and anecdotal evidence of effectiveness, while ensuring the product's label does not make explicit disease claims. Option B. Recommending the herbal product and stating that it has been shown in studies to treat or cure the patient's specific health concern, as this is the reason the patient is seeking alternative support. Option C. Recommending the herbal product based on scientific literature that supports its efficacy for the patient's specific health concern, while ensuring the product is sourced from a reputable manufacturer with good manufacturing practices, and that all communication adheres to FDA guidelines for dietary supplements. Option D. Recommending the herbal product and providing information about its potential to support or promote healthy bodily functions, while advising the patient to consult their primary care physician for any medical conditions. Correct answer is A. Recommending the herbal product based on its traditional use and anecdotal evidence of effectiveness, while ensuring the product's label does not make explicit disease claims. Explanation. This scenario is professionally challenging because it requires a certified functional medicine practitioner, CFMP, to navigate the complex and often evolving regulatory landscape surrounding herbal medicine and phytotherapy within the United States. CFMP must balance patient-centered care with strict adherence to federal and state laws, particularly concerning product claims, labeling, and the distinction between dietary supplements and drugs. The primary challenge lies in ensuring that any recommendations or information provided about herbal products are accurate, evidence-based, and compliant with the Food, Drug, and Cosmetic Act, FD&C Act, and relevant FDA guidance. The correct approach represents best professional practice because it prioritizes patient safety and regulatory compliance. By focusing on evidence-based efficacy and adhering to FDA guidelines for dietary supplements, the practitioner ensures that recommendations are grounded in scientific literature and do not make unsubstantiated claims that could misrepresent the product's intended use or efficacy. This aligns with the ethical obligation to provide truthful and accurate information and avoids potential legal ramifications for the practitioner and the patient. An incorrect approach that involves making direct therapeutic claims for an herbal product, such as stating it will cure a specific disease or treat a medical condition, represents a significant regulatory and ethical failure. Under the FD&C Act, such claims would classify the herbal product as a drug, requiring FDA approval for safety and efficacy, which most herbal supplements do not possess. This misclassification can lead to FDA enforcement actions, including product seizure and warning letters. Ethically, it is a failure to provide accurate information and potentially misleads patients into believing a supplement has medicinal properties it is not legally recognized to have. Another incorrect approach, such as recommending an herbal product based solely on anecdotal evidence or traditional use without considering scientific validation or potential contraindications, is also professionally unacceptable. While traditional use can be a starting point, a CFMP has a responsibility to evaluate the current scientific understanding of an herb's safety and efficacy. Relying solely on anecdote can expose patients to ineffective treatments or potentially harmful interactions, violating the principle of do no harm and failing to uphold the standard of care expected from a qualified practitioner. A third incorrect approach, failing to disclose the source or quality control measures of an herbal product, is an ethical lapse. While not always a direct regulatory violation for the practitioner, unless they are also the distributor, it undermines transparency and patient trust. A CFMP should be knowledgeable about the products they recommend, including their manufacturing standards, to ensure quality and safety. This lack of diligence can indirectly lead to patient harm if the product is of poor quality or contaminated. The professional decision-making process for similar situations should involve a systematic evaluation. First, identify the patient's health goals and concerns. Second, research the available herbal options, prioritizing those with robust scientific evidence for safety and efficacy. Third, consult reputable databases and peer-reviewed literature. Fourth, critically assess the regulatory status of the herb and any claims made by manufacturers, ensuring they align with FDA guidelines for dietary supplements. Fifth, consider potential interactions with existing medications and individual patient factors. Finally, communicate all findings, recommendations, and potential risks transparently to the patient, empowering them to make informed decisions. Question 17. Quality control measures reveal that a patient presents with persistent fatigue, joint discomfort, and recurrent mild infections, with preliminary laboratory markers suggesting elevated inflammatory cytokines. The CFMP is tasked with developing an initial strategy to address these symptoms. Which of the following approaches best aligns with the principles of functional medicine and regulatory expectations for a CFMP? Option A. Focus solely on managing the recurrent infections with targeted antimicrobial strategies, disregarding the broader inflammatory and fatigue symptoms. Option B. Recommend a personalized, evidence-informed dietary and lifestyle intervention plan focusing on reducing pro-inflammatory triggers and supporting immune resilience, based on a comprehensive assessment of the patient's history, environment, and potential genetic predispositions. Option C. Prescribe a broad-spectrum anti-inflammatory supplement regimen targeting the elevated cytokine levels, without further investigation into the underlying causes. Option D. Advise the patient to undergo extensive genetic testing to identify all potential predispositions to inflammation and immune dysfunction before any intervention is considered. The correct answer is B. Recommend a personalized, evidence-informed dietary and lifestyle intervention plan focusing on reducing pro-inflammatory triggers and supporting immune resilience, based on a comprehensive assessment of the patient's history, environment, and potential genetic predispositions. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Certified Functional Medicine Practitioner, CFMP, to navigate the complex interplay between inflammation, immune system dysregulation, and the patient's subjective experience, while adhering strictly to the regulatory framework governing their practice. The CFMP must balance evidence-based functional medicine principles with the need for clear, actionable, and ethically sound recommendations that do not overstep their scope of practice or make unsubstantiated claims. Challenge lies in translating complex biological processes into practical, patient-centered guidance that respects regulatory boundaries. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment of the patient's inflammatory and immune status through a multifaceted lens. This includes considering lifestyle factors, environmental exposures, and genetic predisposition, which are foundational to functional medicine. By recommending a personalized, evidence-informed dietary and lifestyle intervention plan, the CFMP is acting within their scope, focusing on root cause resolution and supporting the body's innate healing mechanisms. This approach aligns with the ethical imperative to provide patient-centered care and avoid generalized or potentially harmful interventions. It also implicitly adheres to regulatory guidelines that emphasize the importance of individualized care plans and evidence-based practice, without making specific diagnostic or treatment claims that would require medical licensure. Incorrect approaches analysis. An approach that focuses solely on a single supplement or a broad, unpersonalized dietary change without a thorough assessment fails to address the multifactorial nature of inflammation and immune dysregulation. This could be considered a regulatory failure if it implies a guaranteed outcome or a treatment for a specific condition without proper substantiation, potentially misleading the patient. Ethically, it is a failure to provide comprehensive, individualized care. An approach that relies heavily on diagnostic testing without a clear plan for interpreting and integrating the results into a holistic intervention strategy risks over-medicalization and may not lead to actionable insights. From a regulatory perspective, making definitive diagnoses or treatment plans based solely on specific tests without considering the broader clinical picture could be problematic. Ethically, it may not be the most efficient or effective use of patient resources. An approach that dismisses the patient's subjective experience and focuses exclusively on objective laboratory markers, without acknowledging the impact of inflammation and immune dysregulation on well-being, is ethically deficient. It fails to recognize the patient as a whole person and may lead to a lack of adherence to recommendations. While not necessarily a direct regulatory violation, it undermines the core principles of patient-centered care that are implicitly expected within professional practice. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with a thorough understanding of the patient's history, symptoms, and lifestyle. This is followed by a comprehensive assessment that may include relevant functional testing, interpreted within the context of the individual's unique biological makeup. Interventions should be personalized, evidence-informed, and focused on addressing root causes. Throughout this process, practitioners must remain acutely aware of their scope of practice, regulatory requirements, and ethical obligations, ensuring that all recommendations are clear, actionable, and do not constitute unsubstantiated claims. Continuous professional development and adherence to established practice guidelines are crucial for navigating complex cases effectively and ethically. Question 18. The risk matrix shows a client presenting with a constellation of symptoms including fatigue, brain fog, digestive distress, and intermittent joint pain. The practitioner has conducted an initial intake and is planning the next steps for a comprehensive functional assessment. Which approach best aligns with the principles of a thorough systems review and functional assessment within the scope of a certified functional medicine practitioner? Option A. Prioritize investigating the most prominent symptom clusters, such as fatigue and brain fog, to identify potential underlying systemic dysfunctions that could be contributing to the digestive distress and joint pain. Option B. Focus solely on the digestive distress, as it is often a root cause of many other seemingly unrelated symptoms. Option C. Recommend a broad spectrum of laboratory tests covering all possible organ systems to gather extensive data before formulating any hypotheses. Option D. Immediately initiate a detailed investigation into every single reported symptom, regardless of perceived severity, to ensure no potential issue is overlooked. Correct answer is A. Prioritize investigating the most prominent symptom clusters, such as fatigue and brain fog, to identify potential underlying systemic dysfunctions that could be contributing to the digestive distress and joint pain. Explanation. Scenario analysis. This scenario presents a common challenge in functional medicine, where a client exhibits a complex interplay of symptoms across multiple body systems. The practitioner must navigate the need for a comprehensive understanding of the client's health without overwhelming them or the diagnostic process. The challenge lies in prioritizing the most impactful areas for initial investigation while acknowledging the interconnectedness of bodily functions, all within the ethical and regulatory boundaries of practice. Correct approach analysis. The correct approach involves a systematic, yet flexible, application of the system's review and functional assessment. This aligns with the principles of functional medicine, which emphasizes identifying root causes rather than just symptom management. By focusing on the most prominent symptom clusters and their potential underlying systemic dysfunctions, the practitioner can develop a targeted and efficient initial plan. This approach respects the client's experience, prioritizes actionable insights, and adheres to the ethical obligation to provide competent and evidence-informed care. It also implicitly acknowledges the regulatory expectation for practitioners to operate within their scope of practice and to gather sufficient information to formulate a safe and effective plan. Incorrect approaches analysis. An approach that immediately delves into highly specific, niche interventions without a foundational understanding of the client's overall systemic status risks misdirection and inefficiency. This could lead to a failure to identify the primary drivers of the client's health issues, potentially delaying effective treatment and wasting client resources. Ethically, this could be seen as a lack of due diligence in the initial assessment phase. Another incorrect approach would be to dismiss or downplay significant symptom clusters based on a preconceived notion of what is most important. This disregards the client's subjective experience and the potential for these symptoms to be critical indicators of underlying dysfunction. This approach fails to uphold the ethical principle of patient-centered care and could lead to an incomplete or inaccurate assessment, potentially violating regulatory expectations for thoroughness. Finally, an approach that attempts to address every single symptom in exhaustive detail from the outset is impractical and can lead to diagnostic paralysis. This can overwhelm the client and the practitioner, making it difficult to establish clear priorities and develop a coherent plan. While comprehensive, this method lacks the strategic focus necessary for effective functional assessment and could be viewed as an inefficient use of professional expertise and client resources, potentially falling short of regulatory standards for effective practice. Professional reasoning. Professionals should approach systems review and functional assessment by first identifying the client's chief complaints and their impact across various body systems. This involves active listening and open-ended questioning. Next, they should consider the interconnectedness of these symptoms, looking for patterns that suggest underlying systemic imbalances, e.g., inflammation, gut dysbiosis, hormonal imbalances, neurotransmitter dysregulation. The practitioner then prioritizes areas for deeper investigation based on the severity and potential impact of the symptoms, as well as the client's goals. This iterative process allows for a dynamic and client-centered assessment, ensuring that the most critical issues are addressed efficiently and effectively. Question 19. The assessment process reveals a client presenting with chronic fatigue, poor concentration, and recurrent infections. The client reports a generally healthy diet, but admits to frequent consumption of processed foods and occasional skipped meals. Based on this initial information, which of the following approaches best reflects the role of a certified functional medicine practitioner in addressing potential macronutrient and micronutrient impacts? Option A. Recommend a comprehensive dietary overhaul focusing on whole foods, with targeted supplementation for key micronutrients identified through a detailed food diary, analysis, and consideration of functional laboratory markers. Option B. Prescribe a high-dose, broad-spectrum multivitamin and mineral supplement to address potential widespread deficiencies. Option C. Advise the client to immediately eliminate all processed foods and significantly reduce carbohydrate intake to improve energy levels. Option D. Suggest a trial of a specific B vitamin complex and vitamin C, as these are commonly associated with energy and immune function. The correct answer is A. Recommend a comprehensive dietary overhaul focusing on whole foods, with targeted supplementation for key micronutrients identified through a detailed food diary analysis and consideration of functional laboratory markers. Explanation. Scenario analysis. The scenario presents a common challenge in functional medicine practice, where a client exhibits a constellation of symptoms that could be linked to macronutrient or micronutrient imbalances. The practitioner must navigate the complexity of identifying the root cause, distinguishing between potential deficiencies, and recommending appropriate interventions without overstepping the scope of practice or making unsubstantiated claims. The challenge lies in synthesizing assessment data, applying functional medicine principles, and ensuring recommendations are evidence-based and aligned with regulatory expectations for practitioners. Correct approach analysis. The correct approach prioritizes a comprehensive assessment to identify specific nutrient needs and potential underlying causes of imbalance. This involves a thorough review of the client's dietary intake, lifestyle, medical history, and potentially functional laboratory testing. Recommendations should then be tailored to address identified deficiencies or excesses, focusing on dietary modifications, targeted supplementation, and lifestyle adjustments. This approach aligns with the principles of functional medicine, which emphasizes personalized care and addressing the root cause of health issues. From a regulatory and ethical standpoint, this method ensures that interventions are based on individual needs and evidence, avoiding broad generalizations or unsubstantiated therapeutic claims. It respects the client's autonomy by providing education and empowering them to make informed choices. Incorrect approaches analysis. Recommending a broad-spectrum multivitamin without a specific assessment of deficiencies is an incorrect approach. This fails to address the individual's unique needs and may lead to unnecessary expense or even adverse effects if certain nutrients are already in excess. Ethically, it represents a lack of personalized care and a departure from evidence-based practice. Regulatory bodies often expect practitioners to base recommendations on objective findings rather than generalized assumptions. Suggesting a drastic elimination diet for all macronutrients without clear evidence of specific intolerances or allergies is also an incorrect approach. Such restrictive diets can lead to further nutrient deficiencies and negatively impact the client's quality of life and adherence. It bypasses the crucial step of identifying specific triggers and can be considered an overly aggressive intervention without sufficient justification, potentially violating ethical guidelines regarding patient well-being and responsible practice. Focusing solely on symptom management through high-dose supplementation of a single nutrient without investigating the underlying cause is another incorrect approach. This treats the symptom rather than the root cause, which is contrary to the core principles of functional medicine. It may also lead to nutrient toxicity or mask more serious underlying conditions. This approach lacks the depth of analysis required for effective functional medicine practice and could be seen as unprofessional and potentially harmful. Professional reasoning. Professionals should adopt a systematic approach that begins with a thorough client assessment, including dietary analysis, symptom review, and consideration of functional testing. This data should then be analyzed to identify specific macronutrient and micronutrient needs or imbalances. Interventions, whether dietary or supplemental, should be personalized, evidence-based, and clearly communicated to the client, including potential benefits and risks. Continuous monitoring and reassessment are crucial to gauge effectiveness and adjust the plan as needed. This iterative process ensures that care is client-centered, ethically sound, and compliant with professional standards. Question 20. Process analysis reveals that a certified functional medicine practitioner, CFMP, is consulting with a patient who expresses a strong interest in incorporating homeopathic remedies into their treatment plan for chronic fatigue, alongside the functional medicine interventions being discussed. The CFMP must determine the most appropriate and ethically sound approach to address this patient's request within the regulatory framework of their practice. Which of the following represents the most professionally responsible course of action? Option A. Immediately incorporate specific homeopathic remedies into the patient's treatment plan, assuming that if the patient requests it, it is a valid adjunct to functional medicine, and proceed with prescribing them alongside other recommended supplements. Option B. Politely but firmly dismiss the patient's interest in homeopathy, explaining that it falls outside the scope of evidence-based functional medicine, and that the practice will only focus on scientifically validated interventions. Option C. Engage in a thorough discussion with the patient about their interest in homeopathy, clearly explaining the scientific evidence, or lack thereof, supporting homeopathic principles and remedies, differentiating them from evidence-based functional medicine interventions, and ensuring the patient provides informed consent for any chosen course of action, whether it includes or excludes homeopathy. Option D. Recommend a specific homeopathic remedy that is commonly used for fatigue symptoms, without further discussion, to accommodate the patient's request and maintain a positive therapeutic relationship. The correct answer is C. Engage in a thorough discussion with the patient about their interest in homeopathy, clearly explaining the scientific evidence, or lack thereof, supporting homeopathic principles and remedies, differentiating them from evidence-based functional medicine interventions, and ensuring the patient provides informed consent for any chosen course of action, whether it includes or excludes homeopathy. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a certified functional medicine practitioner, CFMP, to navigate the integration of homeopathic principles into a patient's care plan while adhering strictly to the regulatory framework governing their practice. The challenge lies in distinguishing between evidence-based functional medicine interventions and complementary therapies like homeopathy, ensuring patient safety, informed consent, and compliance with professional standards that may not explicitly endorse or prohibit homeopathy. The practitioner must balance patient autonomy and their right to explore various therapeutic options with the professional obligation to recommend interventions supported by robust scientific evidence and within the scope of their CFMP certification. Correct approach analysis. The correct approach represents best professional practice because it prioritizes patient-centered care and evidence-informed decision-making within the established regulatory framework for CFMP. This involves a thorough assessment of the patient's condition, a comprehensive review of their medical history, and an open discussion about all potential treatment modalities, including homeopathy. The practitioner must clearly delineate what is considered standard functional medicine practice versus complementary approaches, ensuring the patient understands the scientific basis, or lack thereof, for each. Crucially, this approach mandates obtaining informed consent, where the patient fully comprehends the proposed interventions, their potential benefits, risks, and limitations, especially concerning homeopathy's lack of conventional scientific validation. This aligns with ethical principles of beneficence, non-maleficence, and patient autonomy, and implicitly respects the regulatory boundaries by not misrepresenting homeopathy as a scientifically validated functional medicine modality. Incorrect approaches analysis. An approach that involves directly recommending a specific homeopathic remedy without a thorough functional medicine assessment, and without clearly articulating the scientific standing of homeopathy would be a regulatory and ethical failure. This misrepresents the evidence base for homeopathy and could lead to the patient foregoing or delaying evidence-based functional medicine treatments, potentially causing harm, non-maleficence violation. It also fails to uphold the principle of informed consent by not adequately educating the patient about the nature of homeopathic treatment. Another incorrect approach would be to dismiss homeopathy outright without engaging in a respectful dialogue with the patient about their interest or beliefs. While a CFMP primary focus is on evidence-based functional medicine, a complete disregard for a patient's expressed interest in complementary therapies can damage the therapeutic relationship and undermine patient trust. Ethically, this can be seen as a failure in patient-centered care and communication. Finally, an approach that integrates homeopathic remedies into a functional medicine treatment plan, as if they were equivalent to scientifically validated interventions, without clear differentiation or qualification, would constitute a significant ethical and potentially regulatory breach. This misleads the patient about the efficacy and scientific standing of homeopathy, violating principles of honesty and transparency, and could lead to inappropriate treatment choices. Professional reasoning. Professionals should approach such situations by first grounding themselves in the established scope of practice and regulatory guidelines for CFMP. This involves a commitment to evidence-based interventions. When a patient expresses interest in complementary therapies like homeopathy, the professional reasoning process should involve 1. Active listening and empathetic engagement with the patient's perspective. 2. A comprehensive functional medicine assessment to identify underlying physiological imbalances and determine appropriate evidence-based interventions. 3. Transparent and honest communication about the scientific evidence supporting or refuting various treatment modalities, including homeopathy. 4. Clearly distinguishing between functional medicine interventions and complementary therapies, explaining the basis for each. 5. Ensuring robust informed consent, where the patient understands the rationale, potential benefits, risks, and limitations of all proposed treatments. 6. Documenting all discussions and decisions thoroughly. This systematic approach ensures patient safety, upholds professional integrity, and respects regulatory requirements.